Johnston.
Thank you, Madam Speaker. Madam Speaker, I have a question for the Minister for Domestic Violence. I've been asked to raise this question by people from my community who I represent, including survivors of violence, those currently experiencing violence and those working at the front line to support them. They're desperate to know when action will be taken. Minister, I understand the need for carefully evaluating what we are doing. I understand that we should not be investing in things unless we are clear that they are evidence-based and they will work. I understand that we need to listen to the experts, the sector and the frontline workers. I agree with all of this. Minister, can you outline the process and timeframes for the government plan to implement the coronial recommendations and the $180 million you have committed to, including who you will be consulting with and at what date you will be communicating the outcome of that process and be acting on this issue? Thank you.
Minister for the Prevention of Domestic Violence.
Thank you, Madam Speaker, and thank you, Member for Johnston, for your question. As I have repeatedly said now in this House, we will not rush the response. We will carefully consider the recommendations that have made, and that process has already commenced. When I say we will not rush the response, I'm not saying we're going to leave it till the year after next or the year after that. I'm saying we are going to look at what's happening on the ground. We will continue to consult with service providers. We will continue to discuss the demands and the needs on the system with our non-government sector. And most importantly, we will continue to consult with survivors. We will make sure that what we are doing is effective. Whilst I appreciate there's a framework in place that has focused very strongly on developing policy, developing officers, developing concepts, which are important. Everything needs a foundation. We have now reached the point where we need to make sure that the services that are in place are actually hitting the mark and that we can measure what those marks are. What we do know for certain is that over the past 8 years, we have seen an increase in domestic violence assault. So clearly there is something not working in this sector, and we cannot continue funding services that are not showing us a very real, very responsive result on the ground for those people who are the victims of domestic violence. We cannot continue to have a system that sees an increase in children being placed into care because they are living in circumstances filled with violence, fueled by alcohol. We must take care to ensure that the money that is in play, which is already being deployed where it is needed, there are already programs being funded, there are already work being done. I have consulted with our advisory groups, I have consulted with the people on the ground. We will deliver what is needed to achieve real results. We will not continue to fuel a system that is not delivering real results, and the only results we need to see is a reduction, not an increase, not an 82% increase in domestic violence assaults, but a reduction in domestic violence assaults, and most importantly, a reduction in the number of children who are being placed to care, because they should be front and centre of everything that we do.